Often what we find is people come into hospital, they've come in for maybe a life-changing event or condition, and often at the top of their minds is bills, money worries, and not just about the health condition. So to be able to go and support those patients and people using the hospital to offer that little bit of assistance is vital.
You're looking at all avenues of all the bills coming out, but again, the feeling I just think, I've reached the point, I just don't know what I'm going to do next. I really don't know. So when the staff nurse told me about this person, Sarah, she was brilliant. She listened to everything. There was bits that I was even talking about she didn't have to know, but yeah, she was brilliant at listening. Completed the work, and basically within a month, everything felt, it was just like, yep, that's you. You're getting that benefit. The money, getting that money eventually kind of was out my overdraft, and it was like seeing my bank account not in the minus anymore. It was that first time of feeling, I feel safe. That's the only way I could say it. I wasn't staying alive, staying alive to be in debt. I was not saying or thinking like that anymore.
Many of our patients come from challenging and complex social backgrounds, and financial pressures and worries can have a huge impact. Often patients that we treat in terms of their clinical presentations are subsequently discharged from hospital back into the same social conditions and reattend repeatedly as nothing has changed.
We had a gentleman fairly recently who came in, his home was in absolute disarray, and he hadn't paid any bills for a very long time. All his power had been cut off. He's a very unwell man, even because he has a treatment-resistant condition. But when he's been in hospital, been treated, he tends to improve slightly. However, his bills were through the roof. There was no way of managing them, and the man from Money Matters, Damon, managed to come in, managed to get an agreement with the power company. In addition, Damon looked at the gentleman's budget, looked at his daily budget, what he had, helped him to, apply for additional benefits. He wasn't applying for everything he was entitled to. So he maximised the money that this gentleman was earning. Oh, it made a huge difference. I mean, he was living in absolute squalor. He wasn't able to wash because he had no hot water. His house was absolutely freezing. How he managed, and so that allowed him to go back home and live a much better life, a much better, more healthier and happier life as well.
Having access to financial help and support is of great benefit to our patients, and as has been shown through similar initiatives in primary care, will improve their well-being and help to reduce the need for emergency healthcare.
Money advice and support can be life-changing for our patients. The referral process is very simple. All we need are a few details. Contact us at ggc.moneyadvice@nhs.scot. For more information on our hospital-based money advice services, go to www.nhsggc.scot/money advice.